high amount contribution to maternal mortality globally. So, but by problem statement, one of the outstanding factors that hinders timely access to maternal care and thereby contributes to maternal issues, maternal mortality, morbidity, and infant issues is the problem of delay. And we see that maternal complications are often unpredictable. They often occur suddenly. They are often life-threatening, and they often require immediate intervention and prompt action. And most often, in most cases, you'd find that the delays usually are what contributes to increasing morbidity, lack of access, prompt access to care, and this usually contributes to the problem of maternal morbidity and mortality. And delay in the decision to seek medical attention is often due to the inability to recognize obstetric complications, probably in most cases due to lack of knowledge, lack of sufficient capacity to recognize danger signs during pregnancy. And the lack of knowledge basically is as a result of lack of access to information, lack of sufficient health literacy, as it has to do with maternal health. And information delivery on obstetric conditions and danger signs is usually developed or delivered to pregnant women most often during their hospital visits. So that means that most of the time, pregnant women do not necessarily or are not often skilled enough or sufficiently knowledgeable to be able to know how to recognize or how to identify complications in most cases. And also, in addition to that, it has been identified by researchers as well that women's level of education and social status often determines the amount of information that they have, the amount of access they have to information. So that also plays a role with regards to being able to recognize and respond appropriately to maternal complications. Now, we found that recently we found an increase in availability of information in recent years because of a widespread access to information, computer technology, information and communication technology. We found that there's an overwhelmingly improvement in access to information, where you can get a lot of information available on in social media, on the internet and all of that. So that has made information much more available. However, you'll find that sometimes it's confusing what information is true, what information is not true, which one is applicable to me, you know, and even though information has become widely available, it's still a challenge for pregnant women to access information and use that information to make informed decisions as regards their health. Now, we found also, in addition to this, that as the ICT sector has experienced a boom in recent years, we'll find that mobile health has also come to the fore. And mobile health basically involves the utilization of mobile devices in the delivery of health services. So there's increasing access, global access to ICT mobile devices, especially cell phones, within which there are a number of applications that can be utilized to disseminate health information, and also for self-quantification. Basically, health self-quantification basically means that a person is able to keep information regarding themselves or monitor some of their health parameters by themselves. And this also has been able to allow people to monitor, to change behavior, and also to be able to pass on information to health professionals where they can intervene, amongst others. Now, the study that I'm conducting will basically highlight the need and also the acceptability of a simple intervention that would be used to improve health literacy or maternal health literacy, and also to empower pregnant women with relevant information. It will also, through the self-quantification aspect of the intervention, it will also provide for a simple early warning sign or early warning alert system that women can utilize And this will also facilitate women taking prompt action and minimize delays in seeking help where the help is required. So at the end of this study, I'm hoping to come up with a framework that would be a springboard to develop a simple, cheap, widely available, easy to use mobile health intervention that would be adaptable to the needs of users. And this intervention will also be in keeping with current global trends, and it will also be adaptable, hence it will contribute to advancement in knowledge and innovation, especially in the confluence between healthcare and the information technology sector. So basically my aims and my objectives as follows. So with regards to the aim, I intend to explore the utilization of a mobile application for information and an alert system in obstetric emergencies. And then the specific objectives will be to evaluate the need and acceptability of the mobile application in healthcare among obstetric patients and the health practitioners as well, and also to evaluate the existing systems for timely response to obstetric emergencies. And lastly, to create a framework for the design of an early alert system for obstetric emergencies with a mobile application. So this I intend to achieve at the end of my research endeavor. So with regards to the methodology, my study population is going to be health workers who offer obstetric services to pregnant women. And then it will also be women of reproductive age between 18 to 45 years, and women who have been pregnant within the last 5 years, because they would have had experiences during their pregnancies and they would be knowledgeable enough to provide the information that I require to guide me as I do this research. The study design is going to be a cross-sectional study on which I will collect quantitative data. And the sample size is going to be 100 individuals, in which I will have 25 health workers who are offering obstetric services. And then I'll also have 75 women who have been pregnant and have utilized obstetric services in the last 5 years. And then for the sampling, I'm going to use a convenient sampling method because of the peculiarity of the setting in which I'm doing the study. And then I'm going to do an inclusion, my inclusion criteria, is going to be health workers who have offered obstetric service for a minimum of 6 months. And then with regards to the women, the inclusion criteria will be women who have been pregnant within the last 5 years. So moving on with the methodology, I will collect data using a quantitative method. I will use 2 questionnaires. One questionnaire will be designed for the health workers, and the second questionnaire will be designed for obstetric clients or women who have been pregnant in the last 5 years. And the questionnaires will elicit information with regards to possible sources of delay during obstetric emergencies, access to obstetric information or maternal health information amongst the pregnant women, the need for an mHealth application in obstetric care, and also recommendations from both the health practitioners as well as the women with regards to specifications that they would like to see in an mHealth application that is designed for obstetric care. So that is some of the information I will be collecting using the questionnaire. Both tools will be pre-tested before the data collection begins to ensure reliability and validity of the data that is collected. And if there are any changes, then the changes will be made to the data collection tools accordingly. Then I will, for data management, I will be using SPSS, also known as a package for the social sciences, version, I believe is version 27 for the data analysis, and data will be analyzed using inferential and descriptive statistics. And I will use a p-value of 0.05 for my for reaching conclusion with my statistical tests. Then the limitations of the study, basically one of the main limitations I've identified would be some sampling bias because of using a convenient sampling method. And this might introduce bias into the study. Ethical considerations. Ethical approval will be sought or will be secured or obtained before the study begins. And then I'll also ensure that there's full disclosure of information to all the study participants so they are fully aware of what the study is about, and they can make informed decisions. So informed consent will be obtained from all the study participants. Participation will be purely on a voluntary basis, and there will be no penalties for those who refuse to participate. And any of the participants can allowed to withdraw at any point they wish to do so within the study. But the information collected during the study will be kept strictly confidential in a password protected file, in a password protected computer that only only I have access to. And then there will be no harm. None of the participants will be subjected to any harm during the conduct of the study. So basically, this is what I intend to do. This is what I'm hoping to do. I'm currently working on my data collection as the proposal has been approved and I've obtained a permission to move forward with the study. So I'm currently at the stage of data collection. So in conclusion, maternal and child health issues need to be central in health service delivery due to the proportional contribution that this demographic makes to the population size, as well as the vulnerabilities that lie within this group. We find that this is a particular demographic, women in reproductive age and children, contribute a huge percentage to population groups. And then in addition to that, they carry the burden of quite a lot of health challenges. And therefore they are quite an important demographic that need attention in health interventions. Several programs and strategies have been developed to address these issues. However, you will find that morbidity and mortality from these issues still remain a major issue, especially in low-income settings. Like we saw from the map that I presented earlier, you'd find that there are huge disparities between high-income countries and low-income countries. So this is a major challenge that warrants attention. And this study will therefore reveal the need for an mHealth application that will provide a simple innovation that can be utilized to improve obstetric health literacy. That will basically mean that women can have information at their fingertips. They will have ready information that is easy for them to consume, tailor-made based on their needs. And this will improve or strengthen their capacity to be able to respond appropriately when there are health complications, or to know what to do when they have complications during pregnancy. And the study will also inform the development of the framework for the design of an application, a mobile application to address obstetric health that specifically targets obstetric emergencies. And like we mentioned, this is a huge need, especially in low-income settings. The study will thereby contribute to efforts to address safe motherhood and health literacy by providing a simple evidence-based innovation, and with the ultimate aim of positively influencing maternal health seeking behavior and thereby reducing delays in accessing care during obstetric emergencies. Like I said, hope the mobile application should prompt women with regards to danger signs, and with self-quantification, it will also provide a simple repository for some information that can provide alerts and prompt the women to respond appropriately when there is a need to do so. So basically that is my conclusion. And these are the references that I utilized to compile my proposal. And with that, I am done with my presentation, and I would like to thank you for listening and respond to your questions or comments if there are any. or any inputs that you have for me. Thank you very much.
Thank you very much, Dr. Larai Akai. I am not involved in anything dealing with care in obstetric emergencies, but I really love this research project. I love it. I love your presentation. You've been extremely clear, to the point, and very, very pragmatic. And I'm convinced that anybody who listens to you must now become fully aware of what is involved. And when we talk about safe motherhood and health literacy in your country, in any other country throughout the world, and that's a very, very powerful topic, powerful presentation, and top of the line performance on your part, Dr. Larai Akai. Thank you very, very much. We are going to turn the floor to our participants for their questions or comments. But I have one of my own, which I would like to share real quick. You may close the presentation at this stage, Dr. Larai. Stopping the, thank you very, very, very much. You are very highly literate when it comes to technology. That's very, very, very good. That's certainly why you focus on such interesting, potentially interesting topic. And I hope your project be implemented to the fullest extent. And when it comes to that element of implementation, Dr. Larai, what comes to my mind is you haven't made any mention of budgeting in terms of pretty much what I call the implementation of the project, since we are talking about the use of mobile application. We're talking about technology, and we all are certainly aware of the high costs involved when we want to implement any dimension of technology. And this is the question I would like to bring up to you at this time. What are your expectations in terms of the actual feasibility of the project, since a significant amount of money would suddenly have to be involved or acquired? Your expectations in terms of how, to what extent do you believe this is going to be possible? I know you are conducting your research project with 100 participants, 25 pretty much like you said from the professionals, and 75 of clients to respond to your questionnaire and going through that experiment. But I assume that you certainly would need to move further than the actual just the research project. You would need to implement that to ensure that a significant portion of the population have access to those obstetrics care and so forth and so on. So what do you expect? What do you believe is going to happen when you start implementing that project?
Okay, thank you very much for the question, for the compliment. I teach with Zoom, so we used it during COVID for teaching. So that's why I've become quite conversant, because everything moved online, teaching and meetings and all of that. So yeah, that's why I'm quite conversant with the use of Zoom. And with regards to your question specifically about the budget, it will be difficult for me to, because I've not thought that far. The project is divided into two phases. The first phase is where I offered the questionnaire, or I administered the questionnaire to my study population, and then I received the feedback. after the feedback, or the information that I will analyze, after I've done my analysis, that will inform the design of the mobile application, or the informed design of a framework. So you see that I was careful with saying I'm designing an application, because I'm also not an ICT professional, so it's a bit difficult. I will have to collaborate with an ICT professional. I've identified a person who is willing to partner with me, and this is a person who is a professional. He designs applications and things like that, and ICT innovations. So I've identified an individual who is willing to partner with me to come up with the framework for, to transfer my framework into like a dummy app that can now be taken forward. So my plan is, the individual I've identified, there's no finance involved, because he knows this is more exploratory. But hopefully, after we design the dummy application, we're hoping to find sponsorship, and moving forward, then I hope now to monetize the application moving forward if we are successful. So I'm still at the exploratory phase, where I'm still collecting information from my participants. And that basically doesn't require a lot of finances, because the questionnaire, I mostly send it out. For those who want the paper questionnaire, I print and I give to them using my own resources, which is not so substantial. And for those who want the electronic, I either email or send it through WhatsApp, and then they fill and return to me. And then I'm going to do the data analysis myself using an application I have. So far, there's not much in terms of finances that I will require. But after when I am done with the data analysis and I have the framework and we develop the dummy application, then I might require resources. So I believe that when the time comes, I will most likely develop a budget based on what the realities are at the time.
Thank you very much, Dr. Akai. I do have another question when it comes to the possibility or need to finance this after project phase, but this is not my symposium, it is the symposium of the students. And I see the hand of Francisca Kama up. And let's go to you, Francisca. Welcome.
Thank you so much for giving me the opportunity to talk. And Dr. Lai, that was an excellent presentation. So that was well done. So however, the first one is about the use of mobile. I'm actually from DRC, but I'm living in Kenya. So where I am from DRC, even having a mobile phone is a luxury. So not everybody has a mobile phone. So how, I don't know where you're from. So for people now, a mobile phone, what are the measures that you can put in place for those people living in rural area who do not have mobile phone at all? So that is the first one. The second question is about the sample size. You say you are going to use 100. I don't know, 100 are pregnant women, or 100 is the number of staff that will be involved. And what is the basis of your sample size? How did you come up with that size? If you can answer those two questions. Thank you again for the opportunity.
Thank you, Francisca. Your response, Dr. Larai. Microphone, please.
Sorry, I forgot that I muted. So thank you very much for your question and for your comments. With regards to what can be done in rural areas, This application is designed to be able to cater to those who have mobile applications, and there's increasing access to mobile applications. However, for those who are in rural areas, we have been involved in interventions that involve people in rural areas where we provide training for community health workers in rural areas. And this training basically entails providing training for them on how to pass on health information, how to monitor, how to have a small support group for women in rural areas. Also, there's a concept known as birth preparedness. And usually this is included in the training, where women are trained on how to be prepared for their birth. So from the moment you discover you are pregnant, how soon should you go to the antenatal clinic? What are the danger signs that are involved? And then also women are provided sometimes, depending on how much access to resources one has for an intervention. They're even provided with what is known as an emergency pack that provides some simple resources that they can utilize should they have an emergency. So it's basically with women who do not have access to a mobile application, one can work with local health workers that are in these kinds of settings to strengthen and empower the health workers as well with knowledge, and also to strengthen them to be able to also transmit that knowledge to women who are pregnant. And also, in addition to that, we can find also how to make connections between people in the rural setting with people with healthcare providers in other settings. For example, one can provide a simple, cheap mobile phone to a community member, and that can provide a link for them with other people in for example, a referral hospital, where they can also easily communicate to say there's this situation, how can you respond, or what can we do in this kind of setting? And then there can be that exchange between the people in the rural setting and those who can provide some support for people in that setting. So that's basically what I can respond with regards to the rural area. We often also provide training for, like I said, for the community leaders to also know how to provide support for pregnant women in those kinds of settings. With regards to the question on the sample size, I adapted the sample size from a similar study that was done. Sorry, let me see if I can. Let me see if I can find. Okay, yes, the study design was adapted from a study done by Preto, Zuleta, and Rodriguez in 2017. So they did a similar study to what I'm doing. So I adapted the sample size from that particular study. And basically the distribution in total is 100 participants, but there will be 75 women and 5 health workers.
Thank you for the clarification, Dr. Larai. One thing that I forgot to ask, I don't know if maybe I am the one who missed that information. What country are we talking about, Doctor?
It's going to be done in Namibia. The study is going to be done in Namibia.
Oh, Namibia. Okay. All right. Thank you again very much. There is a comment on the chat line advising me that there are several hands up. I don't see many, but I can see Maxima. So it's your turn, Maxima. Go ahead, please turn your microphone on, and we are all ears.
Thank you very much, Doctor. Thank you, Doctor, for your wonderful presentation. I'm Maxima from South Africa. I worked on a similar project here in my country, maybe just to find out from you, because the practice in my country is that we have, like the Department of Health has got partners developmental partners who are funded by international agencies like PEPFAR, like the Global Fund, etc. Now, these partners would aid the department by maybe availing the mobile phones and tablets to the community healthcare workers who are working in communities to capture data and then report back to the district. So I'm wondering if in your country there is no such assistance, because you can tap into it and see how best they can assist. But they remain, the resource, the mobile phones and the tablets remain the property of the partners. So when the project comes to an end, the partners would then collect the cell phones and the tablets from whoever they were supporting and then use it elsewhere where there's another project running. Thank you very much.
Yes, thank you very much for that comment. I'm not aware of any such, especially with regards to maternal health. I'm not aware of any such intervention that is available. Generally, even health information management is still a challenge in Namibia. So even a lot of health centers do not necessarily have the right professionals managing health information. And even the community health extension workers' activities are also quite limited in Namibia. So that still remains a challenge. However, this is something that can be explored, and thank you for that. It's something I will consider moving forward after I'm done with my data collection. I intend to reach out to some of these developmental partners to seek partnership moving this project forward. So thank you for that. It was a very useful comment. Thank you very much.
Thank you,
Thank you once again, Larai. Thank you for your question and comment, Maxima. There is something that I noticed. There are several attendees at this symposium, but there are few faces. I do understand that there can be a variety of reasons why people want to hide their faces, temporarily. That can happen. But one reason for our enjoyment is the idea of getting together, even if it's on a virtual mode. It is important that we can see each other. Thank you, Tarek. Thank you, Samuel Omowaye. I hope other attendees will follow through and show their faces. I'm trying to see more faces getting unveiled. And thank you, Swadi Kupen. And more faces are coming on. I love that because, this gets me very, very excited. And this is the type of feeling that I would like to share with everybody. And if we can see each other, whether we are here in the United States, we are in Italy, we are in Cameroon, Nigeria, South Africa, Namibia, Ghana, and so forth and so on, regardless of where we are, with this advanced technology, this era of technology, there is no more distance. We can be several miles apart from each other, but with this fence of technology, an institution like Atlantic International University, the distance is no longer an annoying factor. So please, as long as you don't have any issue with that, we would highly appreciate that you show us your faces, you share your faces. It doesn't matter where you are. You can be driving, you can be, I don't know, at the beach or anywhere you are. This is one very powerful factor or characteristic of distance learning. we make it a reality. So please, let's see our face, your faces, ladies and gentlemen. There is a question right now from Tarek Laosi, so we're going in there. Tarek.
Thank you, and thank you for the presentation for a proposal subject. I think talking about the phones, tablet things, is not, for me, this is my point of view, if we consider that we have radar and we have that we use for the surveillance of the many countries and things and that. So they have the active danger also to human body and human health. So, but more that we have now, or more closer, that we use daily, phones, tablets, and TV and things and that. So our friend, I was listening, she said that many open area or downtown, they are not using phones, things that are less. I would say that they are not far away from the danger, because this is what we know and we are using daily, but the hiding danger are more important, like I said, radar, satellite, and things and that. But the question is, our university, IAU, said that they are ready to help us if we have a problem with any organization and things like that. So, and I saw that you were talking about WHO, the World Health Organization, and you were using the statistic of 2014, if I'm not mistaken. So why? Do you have a problem to accede to the database there, or you want to start and to stop this line? This was my question, and over to you. Thank you, Doctor.
Do you have an answer, Dr. Larai? Thank you, Tarek.
Thank you. There were more. I was looking for information that showed. There's more recent information, but I was looking for something that showed the global picture, and I think that's the only one I could come across. That was the most recent I could come across that showed the global picture. Otherwise, I would have had several pieces of information that I would have had to compare. So it was just for ease of being able to show the global picture, and not much has changed recently when I compared those statistics with what is currently available. Not much has changed. So that was what informed me using that particular picture, and it was from 2015, not 2014. But I do note the concern about whether the information was current or not. But like I said, the disparities remain basically the same.
Thank you very much, Dr. Larai. There is a comment from Francisca Kamakama, which I would like to relay to everybody else if it's missed on your ends, ladies and gentlemen. You remember my recommendation that we turn our cameras on so that we can see each other's faces. But what Francisca is pointing out is very often when they turn their camera on, which requires a larger bandwidth, so the communication becomes unstable, which is something that we do understand, those of us who are familiar with those requirements of computer technology. So yes, it happens very frequently. So if this is the case, you don't have to worry too much. We want everybody to participate, whether you can show your face or not. It would be ideal, of course, if we can achieve that, to show our faces to the world. But if there is some kind of mitigation when it comes to, like I said, larger bandwidth that video communication requires. So please, by all means, do not worry about not being able to show your faces. We can do it. Regardless of what happens on your end, with your sample participation, the entire family of Atlantic International University is very, very happy. So we are moving pretty well with our presentation. Remember the first one we had with Dr. Temba Gola from South Africa, the new one with Dr. Larai from Namibia. Very soon we're gonna have Anne Langat from Kenya. Would like you, Dr. Lambert, to verify whether Anne Langat would be ready for us pretty much in 10-15 minutes from now. But in the meantime, we are still open to questions and comments. Any question that you have, there is no question that is nonsense, that doesn't exist. It is a question because there is a need for clarification. So even if Dr. Larai presentation was really outstanding, pretty much like the first one done by Dr. Temba, there can be a need for additional details or information, and sometimes you might just want to emulate Dr. Larai's performance. There are some elements from her presentation which you would like to understand better. So please feel totally free, ladies and gentlemen, to ask questions or to make comments. If there is a need for some type of addendum, I'll just jump in, or Dr. Lambert will do so, or any one of us can participate with whatever input you have in mind. So, other questions, other hands up? I only see Dr. Temba's hands up.
My
so
hand is up.
Go ahead, Dr. Temba.
Yes, Doc, thanks a lot. I think I was quite impressed with the presentation. I'm not a medical officer, but the intended study is quite interesting. But I'm looking at the end result of the proposal, the actual implementation. I know that there are challenges with technology. Once the research has been done and it has to be implemented, my question is that would the research be able to come up with an alternative tool in cases where there is no infrastructure? Because I think that the subject topic is very interesting, and it cuts across whether some people from rural areas and from some urban areas. But is there any backup in terms of the tool, or will it be able to penetrate where there is no infrastructure? That's the first thing. The other issue, maybe other question is around the issue of funding. Is she intending to seek funding for the actual implementation, or there's an issue of technology which might require some tools to be used to collect that information? Thanks.
Thank you very much, Dr. Temba. Let me remind our participants that what we're doing right now, during this symposium of Atlantic International University, is to reflect upon the concept of exponential personal growth. We all want to grow to whatever extent, but it is ideal, kind of better to grow exponentially. Sometimes there is some type of misunderstanding about this adjective, this epithet, exponential, which we shall be able to differentiate from just the idea of exponential. You know, there is a sample growth, going from 1 to 2 and to 4 and to 6. That is growing, that is growth, but that is not exponential. Remember again, what we shall keep in mind is the element of exponential, the idea of multiplying. So let me have you just pay attention to this real quick.
A regular 12.6 ounce bag of M&Ms today, or 2 M&Ms today, or tomorrow,
further understanding about
16 the
this
next, and to continue the
element
pattern
of
for 2 weeks.
exponential growth.
How many M&Ms would that be? How could we find out? Is there a pattern? In one 12.6 ounce plain bag of M&Ms, there are about 385 M&Ms and approximately 173 peanut M&Ms in the same size bag. So what about in 2 weeks? The choice is for 2 M&Ms today, 4 tomorrow, 8 the next day, 16 the next, and to continue the pattern for 2 weeks. But what is the pattern? How are these numbers related? 2 times 1 is 2, 2 times 2 is 4, 2 times 4 is 8, and 2 times 8 is 16. The pattern skips 2 times 3. It looks like this pattern's exponential, but let's see. 2 to the first power is 2. 2 to the second power is 2 times 2. That's 4. 2 to the third power is 2 times 2 times 2. That equals 8. 2 to the fourth power is 2 times 2 times 2 times 2. That's 16. That fits our pattern. After that, 2 to the fifth is 32. 2 to the sixth is 64. On the 5th day, you will receive 32 M&Ms. On the 6th day, you will receive 64. On the 14th day, it will be the end of 2 weeks. 2 to the 14th is the number of M&Ms you will be given on that day. To know how many M&Ms you have received in all, you need to add the number of M&Ms given to you on each day. The sum of the numbers in the third column is how many you will have in 2 weeks. Their total is 32,766. That's way more than a regular bag. Other applications of exponential growth and decay include biology, physics, economics, finance, and computer technology. I hope you enjoyed this lesson, and thank you for watching.
So I chose the element of M&Ms because I know you all love M&M.
Or 2.
And as a matter of fact, you know, if you want to give me your address, I'll send you several bags of M&Ms for your enjoyment and for you to personally relate more directly to this concept of exponential personal growth. Remember, it's not the idea of adding up elements, it's about multiplying. When you factor in several elements of that effort, of that component, this is what exponential growth is all about. So it was just a little joke, but I hope that you enjoyed watching that quick presentation about exponential personal growth through bags of M&Ms. All right, so again, this is my way of sharing with you the extent that I feel very, very excited to have you, ladies and gentlemen, participate in this symposium of Atlantic International University. The second presentation that we had with Dr. Larai Akai from Namibia was truly outstanding as well. And we want to not only thank you, but commend you, Dr. Larai, for your superb presentation for this symposium of AIU. I don't know if you want to make the last comment before we move on to the next presenter. The floor is back to you, Dr. Larai, if you want to make another comment for our attendees.
Thank you very much. With regards to infrastructure, that was the question asked by Dr. Tenda about if I will design a tool for those who do not have infrastructure for mobile applications, is something that I might consider probably for the future. So I thank you for that direction. And then also with regards to whether I intend to apply for funding, like I said, as soon as I'm done with the first phase, then I will be doing that, and I'll design a proposal to look for support to be able to go to the next phase. So that is my part of what I intend to do. And by way of closing, I would like to thank the AIU for the opportunity to make this presentation and for all the support we get during our studies. I'm really proud to be studying through AIU. So thank you very much, and thank you for the opportunity.
Thank you once again, Dr. Larai, and congratulations. All the best to you and your family, wherever you are in Namibia, or if you want to travel around with your skills and your superb ideas about obstetrics care. So thank you again for doing a wonderful job.